Hello everyone, and welcome to my presentation of my chosen psychological disorder. My name is Brent Wells, and today I'd like to tell you more about anxiety disorders. What is an anxiety disorder? Well, our Psychology 6th edition textbook's definition of an anxiety disorder is a class of disorders in which the primary symptoms is excessive or unrealistic anxiety. Some symptoms are trouble concentrating or making decisions, feeling irritable, tense, or restless, experiencing nausea, abdominal distress, having heart palpitations, sweating, trembling, or shaking, trouble sleeping, and having a sense of impending danger, panic, or doom. Are there more than just one anxiety disorder? An anxiety disorder can be many different things and can affect someone dealing with this disorder in many ways. Most anxiety disorders are developed later in one's life, but others can be born with one or multiple anxiety disorders. Only about 1 in 4 people struggling with these disorders get treated for these conditions. And some different types of anxiety disorders are generalized anxiety disorder, otherwise known as GAD. It is characterized by excessive worry and fear about everyday events or activities. Next, the social anxiety disorder, otherwise known as SAD, involves intense fear or anxiety about social situations and interactions. Next is obsessive compulsive disorder, otherwise known as OCD. It involves obsessive thoughts or behaviors that can be difficult to control. Last is post-traumatic stress disorder, or PTSD. It's a disorder that can develop after a traumatic event, such as a natural disaster or a physical assault. So I'd like to talk about the prevalence of anxiety disorders, how men and women report anxiety. Studies have shown that women are twice as likely to experience anxiety disorders as men. However, this may be since women are more likely to seek treatment for anxiety, while men may be more likely to mask their symptoms to avoid seeking help. Nearly 1 in 10 men experience anxiety, but less than half will receive treatment, leading to higher suicide rates and are more dependent on vices such as recreational drug use and alcoholism. 1 in 3 women meet the criteria for the anxiety disorder during their lifetime, compared to 22% of men. Overall, the lifetime and past year rates were approximately 1.5 to 2 times as common among women, with the greatest differences being in PTSD, GAD, and OCD. Now, there are treatments for anxiety disorders. One of them are antidepressant medications. The best prescribed treatment for someone struggling with anxiety disorder would be a selective serotonin reuptake inhibitor. These types of antidepressants are generally well tolerated and are the first line of treatment for anxiety. Some examples I have are Zoloft, Lexapro, and Prozac. Another type of treatment for anxiety disorders would be psychological interventions. There are many types of psychological interventions, but the best for people with anxiety disorder would be cognitive behavioral therapy, or CBT. This helps identify the negative thoughts or actions one is having or doing and challenging those thoughts and replacing them with new behaviors that reduce anxiety. And last of all, I would like to show some anxiety disorders in the real world. And I have a great example from Megan Rinks on YouTube. She's a female, 30 years old, who is suffering from anxiety, depression, and ADHD. She describes what it's like to have anxiety and her daily struggle with her symptoms. So I'd like to play this little excerpt for you.
It feels like every cell in my body is moving so fast that my veins are blurry. That despite the constant metronome of my heartbeat inside my ears, it's like listening to a spastic drum line. It feels like bees my ears, like a broken white noise machine playing all of the sounds at once. And I don't even realize I'm gritting my teeth or cracking my knuckles or rubbing my forefinger against my pinky or twisting the gold band on my middle finger, holding onto myself like I'm the only lifeline bridging the gap between reality on my own 2 feet and the atomically loud abyss of noises and sounds and feelings of fleeting rushing through my veins.
Thank you for listening to my discussion on psychological anxiety disorder.